Bore pawb, and welcome to Promoting Nurse Leadership in Africa. I'm Beth Kidd. I'm the Senior Development Support Manager at Hub Cymru Africa, and I am hoping I will be joined by Catherine Thomas, the Chair of the Health Links Network, although she seems to have popped off my screen, so I'm hoping we'll get her back in a minute. I'll just do a bit of housekeeping whilst we wait for her to rejoin. This session is in a webinar format. So only the panelists have access to their microphones and their cameras. So all the other participants are muted. We would still really encourage you to participate in the session though. So if you have any questions, please put them in the Q&A box, which is to the right of this screen. There's also a chat function if you want to say hello or make any comments as we go along. Please feel free to do so. There's also a raise hand option. You should have a little icon down the bottom to raise your hand, and we can invite you to make a contribution orally if that would be preferable. We will be running a couple of polls at the end of the session just to get your feedback and to help Hub Cymru Africa and Wales and Africa Health Links Network to be more responsive to their communities. So please give your feedback there. And also just to say, as per all our events, no form of abuse or offensive language or behaviour will be tolerated either in the chat boxes or during the session. So please listen with respect and be mindful of other people's experiences. Catherine, if you're back, which I think you are, yes, I will hand over to you to introduce the speakers. Thank you.
Hi, sorry, I got thrown off the stage. I'm very grateful that wasn't literal, but I crept back on again. So thanks, Beth. I'm delighted to welcome our next speakers for what promises to be a fascinating session. This is about promoting nurse leadership in Africa. And some of you may know about the Nursing Now campaign, which has been a global campaign, which many countries have signed up to. We will hear more about it from Rhiannon Beaumont-Wood. And then we're going to hear a bit more about how the Nursing Now campaign in Wales has engaged globally with some specific examples. So thank you very much for our two illustrious speakers. If I just introduce Rhiannon, who I've worked with and known for some years now. She's got over 30 years experience working in the NHS in Wales and England, starting in 1981. She's worked in secondary care, primary care, ambulance services, community public health nursing, and eventually joined Public Health Wales, and she's become the first Executive Director of Quality Nursing and Allied Health Professionals. So her current role includes leadership for quality and safeguarding in Public Health Wales, and one of her key roles is chairing the Nursing Now steering group for Cymru Wales. And then we're also joined by Professor Diane Watkins, who I've met for the first time this morning, and we are inspired to hear about your role, and your job title is an amazing one. Diane is the Director of International and Civic Mission at the School of Healthcare Sciences at Cardiff University. Her background is as a registered nurse, midwife and health visitor, and she's held numerous international strategic positions. She's done a lot of work with the Ministry of Oman to establish the first nursing and community nursing degree programme. And the skill set that you have is the perfect one to bring to this agenda, Diane. So I'm really pleased to meet you. And I will hand over the floor to the both of you to tell us more about Nursing Now and how it's developed over the last year or two in Wales. Thank you.
Diolch, thank you very much, Catherine, for that, and to Beth, and thank you to all of you for allowing us to share with you some of the things that we have been doing under the sort of Nursing Now banner. It is going to be a presentation of two halves, but the greater half will be Diane sharing a wealth of information and shared collaborative working with Namibia and Malawi in particular. So you will hear more about that shortly. But I'm just going to give you a general whistle-stop tour, really, if you like, in terms of Nursing Now as the global campaign and specifically in Wales. So if you could go to the next slide, please. Thank you. So what is Nursing Now all about? Well, it really was a campaign that was to really bring about raising the profile of nursing and midwifery, actually, across the globe, really seen important to raise both the profile and the status of nursing. So the campaign was launched and filmed both in London and Geneva, Geneva being the HQ for the International Council of Nursing and for the WHO Global itself. A memorandum of understanding was signed between Dr. Tedros Ghebreyesus. I've been trying to say that surname all morning, but still not successfully. But in any event, Tedros, as the Director General, did agree for a memorandum of understanding to be signed. The campaign was really sort of drummed up with the support of Lord Nigel Crisp, who co-chaired with Professor Sheila Tulu the campaign itself. There had, as a precursor to the campaign, been a report that was written, which is known as the Triple Impact Report. And it was really making the connections between growing the profile and understanding and capacity and capability of nursing across the globe would actually bring about improved health, promote gender equality, and support economic growth more broadly. There was also a call in 2020 or pre-2020 actually to designate the Year of the Nurse as an important way of focusing in on nursing as an occupation, as an important step towards supporting improved health, promoting gender equality and economic growth. So the WHO did declare the Year of the Nurse in 2020, and there was lots and lots of things that were planned for that year, both across the globe, but in the UK and obviously in Wales, including celebratory events. But as we all know, those plans were scuppered somewhat by our global pandemic. So I guess nurses and midwives were very placed front and central into central view in terms of the importance of the role of nurses and midwives in delivering health and care across the globe. It wasn't really the 2020 we were looking for to celebrate nursing, but that was what we actually ended up with, isn't it? And we do know very, very sadly that across the world and in Wales that a number of nurses have actually lost their lives in supporting the delivery of health and care for and during the pandemic, which, as we all know, we are still living with currently. So just to go on to the next slide, the campaign aims were for greater investment, in particular in improving education, professional development, standards, regulation, and in the employment conditions for nurses, because obviously that is very variable across the globe. For increased and improved dissemination of effective and innovative practice in nursing, for greater influence for nurses and midwives on global and national health policy as part of broader efforts to ensure health workforces are more involved in decision making. And indeed, for more nurses in leadership positions and more opportunities for development at all levels. And actually that call for leadership positions includes very, very much the government level leadership positions, which again are not in place across all countries, and is obviously a very important role. And then to have more evidence for policy and decision makers about where nursing can have the greatest impact, what is stopping nurses currently from reaching their full potential, and how to address some of these obstacles. Next slide, please. Obviously, the aims of the campaign very much are underpinned as well by the Sustainable Development Goals, in particular, Sustainable Development Goal 3, good health and well-being. And the campaign really is a way of trying to emphasize and continue to raise the profile of nursing in their contribution towards all of that sort of citizen health and well-being. So if we just look at a bit of a timeline here, at the 72nd World Health Assembly in 2019, the Assembly considered the endorsement of the Year of the Nurse. And then obviously that was declared. So in 2020, the Executive Board of the WHO designated that it should be the Year of the Nurse and Midwife. And indeed, what was also agreed that there needed to be the production of the State of the World's Nursing report. So that was produced in 2020 and had data from 191 member states, and came up with recommendations that are very much about a call to action, because there are, and I will quote a little bit later on in the presentation, still some huge deficits and challenges that are facing many countries, including closer to home in Wales. And in terms of the campaign itself, there was a report, and I've said their final report, but actually the campaign is ongoing. But there was a report produced to reflect the 2018 to 2021 period in terms of the impact of the campaign globally. So that was obviously another opportunity to really emphasise the work and the profile and the focus that the Nursing Now campaign has brought about. Just coming closer to home now on the next slide. So we in Wales, and our CNO at the time, Jean White, thought it very important that we had our own Nursing Now Cymru Wales campaign. And we got together a group, and there was a launch of our local Welsh campaign on the 29th of March 2018. And the group has representatives from across both health boards, trusts, academic sector, the RCN, the RCM, and some representation from social care. And that has really galvanised our opportunity to really pool that collective thinking, and really helped us to think about how we can best continue to have impact and grapple with some of the challenges that we face in nursing, and being able to make things better for the population of Wales. So that steering group was formed, and we worked initially to develop 5 high-level themes. If you go on to the next slide, please. So those 5 level themes needed to be contextualized for Wales, but they also needed to link back to the triple impact report, which I referenced earlier on in the presentation. So just to quickly go through those, we thought that building resilience and promoting well-being in our students and registrants was extremely important, and that was pre-pandemic, and obviously that's become even more important now, but we thought it was important anyway. So that was an area of one of our themes. Our next theme was about preparing students and supporting nurses and midwives to recognise their role, responsibility in contributing to prevention, improving individual and population health outcomes. Again, a really important area. So it's not just about delivery of direct health and care, it's in the round in terms of improving individual and population health. The next one then was about actively encouraging and increasing diversity in nursing and midwifery to positively influence inclusion of underrepresented groups, promoting social and economic developments. Again, really, really important that we get behind that and are able to really help our future potential colleagues that better reflect the communities that we serve. And the next one then was about strengthening and building leadership and influencing capability at all levels, a really important area that we've focused on. And then the last one there is about increasing and improving the dissemination of effective and innovative practice in nursing to drive consistency in system-wide adoption. So a lot of that then you will hear we've been able then to share with other countries, and some of that will come through when you hear from Diane shortly. So if we go to the next slide. So one of the things that the steering group was really, really keen to do was to ensure that we raised our profile of all the great things that have been happening in Wales over the last few years and currently, and to produce a report that then would be shared globally. So we produced our Celebrating Nursing and Midwifery in Wales this year. It was completed in July and it was published in September. And that's really putting emphasis on promoting and raising awareness of nursing and midwifery best practice here in Wales, but how we then share that with others. We've been completely inspired in that steering group by presentations by nurses and midwives in many settings. Absolutely phenomenal in terms of some of the innovations and best practice that is currently going on in Wales. And we know that nurses and midwives are the backbone of our health and care systems in Wales, but obviously that is equally true for our colleagues out in other countries. And again, we'll hear some of that from Diane. So just to say, we are now going into our next phase of the steering group. We feel very strongly that there are benefits by us working and collaborating together, not only for us in Wales, but also our role in supporting nations in other settings. And we are considering the Global Strategic Directions for Nursing and Midwifery report, which was published by the WHO this year. And just to say that the legacy of the Nursing Now campaign globally is being taken up and continues with the International Council of Nurses. And we intend to be very sort of plugged in to that global campaign, as well as our focus locally closer to home. So we intend to continue to wish to progress and have impact. And we are refreshing our work plan. And we really are in the space at the moment about considering where our focus, with the same themes, because we still think they're absolutely relevant. But I think what we're looking for the next iteration of the Cymru Wales campaign is where we can have impact, both at home, but also with our partnership working with colleagues overseas. So just the next slide, just to give a little bit of a bit of facts and figures, I guess. So there are currently over 200 groups of the Nursing Now, over 71 countries registered with the International Council of Nursing. There are a number of initiatives that we have been hearing about in our steering group. Not only what you're going to hear about from Diane, but colleagues from the University of South Wales have also been involved in initiatives in collaboration with Uganda. And just to give a couple of headlines for them, what they are really focused on is the fact that nurses and midwives absolutely have the potential to make an enormous difference to the health and well-being of every nation. 72% of the public health workforce in Uganda is often the first point of contact for their population. There is a huge shortage of personnel, and there is limited leadership capacity, which obviously does hinder the ability to improve care. You really do need that leadership. Next slide, please. So in terms of the global challenges, the State of the World's Nursing report does really emphasise that the global nursing workforce is 27.9 million, 59% of which are health professionals, which are nurses. However, there is a 6 million shortage of nurses, and they are concentrated in those low and middle income countries, of which you are obviously fully aware of in this conference. And again, Diane will speak to some of that. The numbers of nurses in the world is not commensurate with the universal health coverage Sustainable Development Goal targets. So that is something we need to address in every country. And so I guess the call to action from the State of the World's Nursing report is a massive acceleration of education, new jobs to the tune of 6 million, and to strengthen nurse leadership at every level, but in particular that every country has that government nursing leadership. So at that point, I'm going to pause. I'm going to hand over to Diane, who will take you through a very interesting presentation on a kind of example of some of the work that we've been focusing on in our steering group. Thank you, Diane.
Thank you very much indeed, Rhiannon. First slide then, Peter, if you're ready to go. I'll just introduce myself. I work at Cardiff University. I'm a professor of public health nursing there, and I have been involved in international work for many, many years. I'm delighted to be with you here this morning, and I want to present to you two really, really interesting projects. Well, I think they're interesting because I have such passion for working in Africa. The first is the Namibian Nurse Leadership Project, and the second is the establishment of a practice development unit at a hospital in Malawi. Next slide, please, Peter. Just a little bit of a background on the countries that I'm going to be discussing today, because I think it puts their health in context of, you know, how does it compare to somewhere like the UK? So if you look at something like infant mortality, that's births under the deaths under the age of 1 year, then you're looking 3.5 deaths per 100,000 in the UK, 27.3 in Namibia, and 32.6 in Malawi. And then maternal mortality, 7 deaths per 100,000 in the UK, 195 in Namibia, and 349 in Malawi. Life expectancy is very, very different in these two African countries compared to the UK, as you can see by the figures for the life expectancy for females and the life expectancy for males. So if you're a female in the UK, you can expect to live till around 82, but actually if you're in Malawi or Namibia, it's around 67, 68, and much lower, you can see there for males. And then deaths under 5 years, we're looking at 4.3 in the UK, 36.3 in Namibia, and 43.7 in Malawi. Next slide, please, Peter. Life in Africa is very, very difficult. These are just some of the photographs of the, I think, difficult living conditions, particularly in rural Africa. If you're talking about the city, if you're talking about the capital of a country like Namibia, then things are different. But if you are living in rural Africa, these are some of the difficulties that you will face. Next slide, please. And here you can see some African citizens washing their clothes in what is a polluted river. And I just want to highlight that because I want to, I suppose, call on some of the words which our CNO mentioned this morning. Working in Africa is like working with people in nowhere else for me, because in terms of teaching you humanity towards others, and humility, then there is nowhere like working in somewhere like Africa. Thank you. Next slide, please, Peter. So the first project I'm going to talk about is enhancing the leadership knowledge and skills of Namibian and Welsh nurses and students, and it's called the Namibian Nurse Leadership Project. And here are some of the people who've worked with me on this project, because obviously I cannot do this alone. I have fantastic people, both in partner countries and here in Cardiff. So these are some of the people: Alison, Gemma, Julia, and my lead in Namibia is Louise Pretorius. Next slide, please. So a little bit about the project background here. I undertook a leadership and needs analysis in June 2018, and I did that in 3 regions of the country, so that I covered rural areas as well as in a city. And I met with a huge number of people, starting at the very top with the Ministry of Health and moving through right down to newly qualified nurses. And out of that needs analysis, a clear need for leadership education in nursing was identified. And I then applied for some Wales for Africa funding for a small grant, which I was successful in achieving, and that has funded this project. Next slide, Peter. So what was that project about? It had many different dimensions to it. The first was around developing joint competencies for use in education by the University of Namibia and ourselves, so that together we pooled our resources and we looked at leadership that would suit and could be utilised when we were teaching students. The second part was to set up a buddying scheme between final year nursing students in Cardiff and in the country of Namibia. The third was to set up a buddying scheme between qualified nurses, and those qualified nurses came from a Namibian health board and from hospitals across the whole of Namibia. And the next point was to actually develop some workshops together and to deliver those workshops in the country, and to focus there on quality improvement. And the final part of the project, to ensure its sustainability, was then to develop leadership champions in through the University of Namibia, who would then cascade that information through. Next slide, please, Peter. So the development of the joint learning outcomes for use in our Bachelor of Nursing programmes by Cardiff and University of Namibia was fairly easy to do. So we achieved it. We differed on assessment strategies, so we didn't actually credit rate it the same in both programmes, but we had the same content. Next slide. The student nurse buddying scheme, and here is a picture of some of the students who undertook, were part of that buddying scheme. We established it for final nursing students, and we asked for expressions of interests from 20 students in both university. And we led those sessions, they were tutor-led. And you can see there that they were around getting to know one another, what nursing was like in another country, in another culture, learning about emotional intelligence and leadership theory, and for them to present scenarios from practice. The lessons learned here were that at the time we were using very different virtual learning platforms. So we use Zoom, and actually University in Namibia use Moodle. So it was trying to kind of bring those together. I think we've moved a long way now, and that wouldn't perhaps be a barrier, but it was at the time. The next issue that we learned was around student commitment in the light of other priorities. So these students are following degree programmes, and although we had our 20 who agreed to take part from Cardiff, actually only 8 of those engaged in the end. We had 24 from UNAM, but actually they weren't the same students. So for each of the sessions you see here, we had different students dipping in and out, and we'd hoped that it would be one sort of one body of students to aid with continuation, but that didn't happen, wasn't really a problem. The evaluations were positive, and we thought, how do we continue the scheme following the project closure? Next slide, please, Peter. Here are some of the evaluations, and certainly both sets of students, I think, benefited from the buddying scheme. I love the first one, who said the amazing part was learning about nursing in the UK, and who knows, maybe one day I'll be a nurse in the UK. And a wonderful comment, the second comment you can see there, interacting with other nursing students in the UK was one of the best moments of my life. So they really did get something from it. And again, our Cardiff students, the last 2 evaluations here, they talked about the similarities and the differences, and that they were glad to be part of it. And the final evaluation, which I put up to highlight, is that it allowed me to compare our training and maybe realise that some aspects are positive as well as negative. And, being able to kind of envisage and hear about nursing in another country, I think was beneficial to both sets of students. Next slide, please, Peter. The qualified nurse buddying scheme, we established that between nurses in 3 regions of Namibia and an Namibian Health Board here in Wales. We invited 15 from each country, and we ran 5 sessions, again accompanied by myself here in Cardiff and somebody else at the University of Namibia. In Wales, we produced films that would kind of try to show the nurses what life was like, a day in the life of a nurse in Wales in community nursing, in A&E, in intensive care. And then we discussed those films over Zoom and over Moodle. And they presented clinical scenarios and talked about how they would deal with them. Because the whole thing was based around leadership. How would you lead this? How would you deal with these different scenarios? Next slide, please, Peter. Again, the differences in the VL platforms at that time did prove difficult. Although we see people have mobile phones wherever you go in Africa, you know, they have a mobile phone. In remote parts of Namibia, it was really, really difficult to get nurses to attend a central point for access, because we couldn't have people using mobile phones all over the place. We needed one central point. And of course, being able to attend those was not always easy, because nurses have clinical commitments. So we found that we had really small numbers from Wales in the end, and we only had 4 who took part in it. And they took part in all of the sessions, so that was great. And we did have low evaluation responses from some of our nurses in Namibia. Next slide, please, Peter. So we did an evaluation pre and post the Qualified Nurse Buddying Scheme, and this is what we found. We were surprised actually that the evaluations were really positive, that although we had small numbers in Cardiff and we had different nurses dipping in and out from Namibia, these are just some of the things that they said, you know, excellent professional connections, an opportunity for education, learning to be a better role model, steep learning curve, learned about frontline work and staffing in another country. Lots of similarities on the background of stark differences, very beneficial sessions. Next slide, please, Peter. So the next part of this project then was the Leadership and Quality Improvement Workshop, which we ran for qualified nurses in Namibia. And the way that we did that was staff from Cardiff University delivered those sessions face-to-face at the University of Namibia, and the nurses attended those sessions. Next slide, please. It was a 2-day workshop. It was initially planned to be delivered in 3 regions of Namibia, one in the city, in Windhoek, and one in very rural areas. We invited 25 to each workshop, so that would have been 75 nurses in total, and those arrangements were undertaken by the University of Namibia. And as I said, the content was delivered by ourselves and also some academic staff from the University of Namibia. Next slide, please. These were the aims of the Leadership and Quality Improvement Workshop, and the picture is a lady who attended the workshop. It was around emotional intelligence and understanding leadership, understanding themselves as a leader, looking at areas for personal development, the barriers to effective leadership and change management, revising the principles of change management. And we used the PDSA cycle as part of our teaching, which is plan, do, study and act. And at the end of that workshop, our expectation was that the attendees would identify a project for change and plan implementation using the PDSA cycle. And then we would evaluate that progress with implementation of the chosen area for change. Next slide, please, Peter. These are some of the change management projects which our attendees chose. You can see there's a whole range of issues here. I won't go through all of them. Infection control featured, forensic psychiatry and improving long-term care, Improving administration of the correct medication, which is a particular problem in the areas I'm working in both Malawi and Namibia. Improving health and care and safety of staff through training in violence and aggression, reducing needle stick injuries, and health education on HEPI. Next slide, please, Peter. The evaluations, and this again is one of our great attendees at the workshop. These are some of the things that they wrote. I enjoyed everything, but mostly on change model, learning about change, where problems are and how they can be faced, interesting participation, and the traits needed for a good leader, and learning from others in the group. Next slide, please, Peter. Evaluations then were that we did a pre and a post via a questionnaire, and we looked at their level of understanding, which of course we don't know whether that is taken into practice. It's just a difference in knowledge, and it's important to think about that really. Here are some of the evaluations on that workshop, and I'll allow you to just quickly read through those. Leadership means to be a good role model, helping and encouraging other nurses to function as a team, etc. Next slide, please, Peter. What did we learn from this project? We had great difficulty in recruiting nurses to attend the workshops that we ran in Namibia. And that was a real surprise, because I had done the needs analysis. So in the end, we didn't run 3 workshops. We just ran 1 workshop in Windhoek. And we had 25 names of people that were due to come, but actually only 11 attended. There are cultural differences in nursing practice, and obviously we needed to adapt our teaching and our expectations. We had 3 from the group who volunteered to become their change champions. However, COVID has affected continuation of the project, and those change champions training and the follow-up on implementation of change management projects actually has not taken place. Namibia feel that they have been heavily engaged in dealing with COVID, and this has fallen to the bottom of their priority list, I'm afraid to say. Next slide, please, Peter. So what's our summary? I would say that our summary of the whole thing is that we were maybe a little bit overambitious, trying to train 75 nurses in 3 different locations. If we did it again, I think we would use much more of a blended approach, and we might have reached larger numbers. Student buddying is certainly a way of connecting students from different countries to help develop their cultural awareness. But qualified nurse buddying across countries, I think, was problematic. And I think clinical commitments, and for us in the parts of Africa we were dealing with, access to technology was difficult. And thought needs to be given to the sustainability of the positive outcomes. There are other priorities, staff shortages, pandemics, as we've heard from today. Next slide, please. So I'm going to talk to you now about a very different kind of project, but it is actually about nurse leadership. It's about establishing a practice development unit on a hospital ward in Malawi. And I'm so grateful to the people who've worked alongside me with this, and that's Dr. Judith Carrier and Bev Johnson from Cardiff, and my wonderful colleagues in Malawi, Chinwemwe and Belinda, who both work at the Kamuzu College of Nursing at the University of Malawi. Next slide, please. So a little bit of a timeline on this is that I was successful with a small Erasmus grant in 2016, and that allowed some staff mobility. So we undertook some visits to Malawi, and Malawi came to Cardiff, and they visited Cardiff and Vale, and they visited Anara, and they observed different sorts of clinical care. That clinical care was acute, community, mental health, etc. And then in 2018, I was awarded a very large Erasmus grant to set up a practice development unit. And that would cover, the funding would cover staff visits, and also 2 PhD studentships for Malawian students to study at Cardiff, and those have taken place. There has been a year delay in that, and so we haven't finished the project in 2021, but we will finish it in 2022. And then in 2019, again, I was awarded some more funding via a Global Challenge Research grant to evaluate the project. And again, there's a year's delay in that evaluation due to COVID. Next slide, please. Okay, so the project aims were to further establish that relationship between Cardiff and ourselves, and this is the meeting with the academic staff at University of Malawi, and then to think about and jointly plan a PDU, this Centre of Excellence for Interprofessional Evidence-Based Care, and then to pilot and evaluate it. Next slide, please, Peter. So what is a practice development unit? I thought it would be really helpful if you knew what that actually referred to. In a hospital, it's often called a model ward. It utilises quality improvement methodologies to help improve practice. It's facilitated, it is around person-centred and evidence-based healthcare using an emancipatory change approach. It can help with enhancing clinical services and quality and safety and improving communication between multidisciplinary teams, aiding the development of shared values and priorities. And it will enable evidence-based knowledge to be translated into practice and improve the quality of care through supporting those practitioners and teams in their clinical environment whilst they implement change. Next slide, please, Peter. So how did we achieve it? Well, we met with the faculty and we met with hospital and ward staff, and we did that across various hospitals in Malawi before Queen Elizabeth Hospital was the hospital that was allocated to us. The management of Queen Elizabeth Hospital asked us to work with a male medical ward, and we then ran a series of workshops with staff from that ward and with the matron who covered the male medical unit, and also with doctors to actually educate them in quality improvement methodology and leadership. Next slide, please. The priority areas that they chose on their ward was actually ward cleanliness, admission and discharge of patients with diabetes, multidisciplinary ward rounds, and renovation of the ward staff room. And I don't know if you can quite see, just down in the corner of the slide, you can see our prioritization exercise that we undertook. These staff came up with around 40 areas that they wanted to improve. And we needed to whittle that down so that we had something that we could focus on to begin with. And that's how we reached these different areas. New slide, please. Okay. So we then looked at the challenges and solutions. When I visited this male medical ward in the hospital in Blantyre, I went to the sinks at both ends of the ward, and there was actually no running water. The toilets were not working, even although this ward had 90 patients on it, with only 60 beds. If you can just imagine that scenario, obviously there are not beds for everyone. So people are on the floor, and it is incredibly difficult to provide care to patients in that environment. The staff room was in a poor state of repair. The kind of challenges which the staff came up with when we did these exercises with them through the prioritization workshops was, how would they get over the resistance to change and the attitudes of some staff? How would they deal with this with their existing workload? How would they own it? How could they feel responsible for it? They didn't feel they had the knowledge, and they feared trying to make the changes. And so we came up with solutions, and those solutions were from the staff themselves, from the ward staff, and certainly from the faculty staff within the University of Malawi that we were working with. And what they said was, there's a local college actually that nearby, they have these, you know, young boys who are doing courses in building and plumbing and maintenance. And they contacted them. And they're the people who actually came and put running water into this ward and repaired the toilets. We sought management support for the changes. We held workshops to try to educate staff and the cleaners and patient guardians. Now, in Malawi, and it's the same in many African countries, patients come into hospital with a guardian, and that guardian is responsible for providing them with food, for doing their washing, and for doing quite a lot of the care whilst they're in a hospital environment. So it was important we got these patient guardians on board. We tried to allay anxieties, we offered mentorship, and the University of Malawi actually allocated a member of their faculty to lead on those world changes, and that person became our project manager, and that was Dr. Chimwenwe Mula. Next slide, please. Then we did an audit of those clinical areas to get a kind of a baseline, because we wanted to evaluate whether we were actually going to make any difference. We at Cardiff then did rapid reviews of the evidence in the priority areas that I showed you earlier. And we developed protocols from that evidence to guide best practice. We did the challenges and solutions again to see how we could help with trying to get over some barriers. We mobilised others, we discussed with management, and we ran many workshops for staff. Next slide, please. This is a picture of the ward staff room prior to renovation. This was something that, you know, we felt, you know, in our book, is this an important area? But of course, if you're trying to build morale and you're trying to actually help nurses and doctors to feel that they have somewhere that they can rest and recuperate in between providing care, then they said this was so important to them. That's a picture sent to me by Malawi, not a picture that I've taken. The next slide, please. We decided, how are we going to actually change this? Because we had somebody to do the building work, but it would be a room with nothing in it. And so myself and Dr. Judith Carrier and Bev Johnson, we had some money left in our fund that we hadn't used for accommodation and for food. And so we put that together. And we went off to the supermarket with our wonderful project lead, Chimwenwe, and we bought what we could with the money that we had left. And so we bought sort of chairs and tables and kettles, and you can see here a fridge and a microwave and whatever we could with the money we had left. And we had that brought to the hospital. Next slide, please. And this is the staff room after the changes, which is really great. You know, staff have somewhere that they can now go and sit and have their coffee and have their lunch. Next slide, please. This was ward cleanliness before the PDU was put into place. And again, these photographs were sent to me by our project lead in Malawi. And in the top of that picture, you can see the mops. So these are the mops that they were using to clean the ward. And these mops would mop up excrement. They would be used in the toilets. They would be used on the ward. They would just be used everywhere, really. And there was no real cleaning regime. And you can see the rubbish here, and you can see the storage of equipment and the sinks. So what we did was put in workshops for cleaners. We followed a protocol, and we taught the ward cleaners how to clean. We changed the preparation. And there was a massive push by the ward sisters, who've been really, really great in this project, to tidy the ward. Next slide, please. This is what the ward looks like now. So everything's away, it's clean, it is really fantastic. Next slide. So I've talked about the workshops. I haven't talked much about the patient guardians. The patient guardians were making a contribution to the difficulties the wards were encountering, because they would take their food in, they would leave the food, they would there was just a general uncleanliness about the whole thing, and so it was important to bring them on board. And when we did was she held some meetings with the guardians and said, we need a chair of a guardians group and we need to talk to you about ward cleanliness. And that guardian is revolving. So obviously when that patient is discharged, a new guardian takes the chair, and that has proved really, really, really great. We've had lunchtime seminars with nurses on the admission and discharge of patients with diabetes. They're implementing the protocol. And on the ward rounds, nurses were not being part of the ward round. It was being held entirely by doctors. They're now attending every ward round, and they use a way of reporting, which we called SBAR, which is Situation, Background, Actions and Recommendations. Next slide, please. And here are some of the guardians, and here are some of the staff teaching the guardians about ward cleanliness. Next slide, please. What have been some of our challenges? Multidisciplinary working, although we had doctors involved in our initial workshops and in learning about quality improvement and prioritisation, it's been really difficult to keep them on board. So although our academics in Malawi have tried really hard, that still remains a difficulty. We've had delays due to COVID, so we've had about a year delay in this project progressing, but I am really, really pleased to say that it is now, in progress and doing really well, as you can see from the photographs. The Global Challenge Research funding was due to be withdrawn. So this wonderful pot I'd have to evaluate the project was about to be withdrawn, and I thought, what can I do with this? And so I quickly transferred it to Malawi, and we appointed a research assistant there who is now doing the evaluation for us. We have regular meetings over Zoom. So every month we have an operational meeting, and every other month we have a steering group meeting, because the steering group oversees the finance and the project progress. Future funding for the project is unknown, because we had a project proposal ready to go into THET, and the UK government removed that THET funding. So that has been difficult. Next slide, please. Next steps. Full evaluation is in progress. We've had interviews with nurses, the unit matron, the ward doctor and ward cleaners, and I have all that data, and that is at the moment being transcribed and analysed. Our re-audits are being undertaken now during November. Our full report will be due in January, and our major aim now is to search and apply for further funding to support the project. And my last slide, please, Peter. Thank you for listening, and I really, really welcome any questions or collaboration that anybody would like to make with me, so that we can try to take projects such as this forward in Africa, because they really, really can make such a difference. Thank you.
Thank you. Thank you so much. That is absolutely packed with information to take in from both of you. So I'm sure that there will be people who are going back and watching the recording to take in. And maybe if you can put your email in the chat on the side, Diane, so people can copy that and get in touch with you to know more. If you don't mind staying another sort of maybe 5 to 10 minutes, because our next session starts at 1 o'clock, so we've got a little bit of leeway. Beth, I know there's a couple of questions in the Q&A. Paul's question is really interesting. I don't know if you can bring up Paul Myers put a question in there.
Okay, so as in Wales, many healthcare staff in Lesotho and elsewhere are so stressed that they have difficulty adopting new skills. Many do not recognise this or know how to cope. We are beginning to acknowledge this in Wales. How can we support our partners?
Would you like me to answer that one? Yeah, can you hear me?
Yes, we can. Yeah.
Good. Right. I think it is about, you know, recognizing the challenges actually that our partners in Africa face. You know, I don't need to say in a conference such as this, you know, we cannot take westernized values and procedures and just take them per se and implement them in Africa. And I think that's what's been so successful about this project is we recognize the absolute hardship that these people face, and you've got to work around it. You've got to, I think, recognize that they do have other priorities, but if you can just get small change, and if you do that gradually, I think they begin to recognize that their working conditions and the way in which they practice can be improved. And you can see that's what's happened here, that, you know, would you be surprised at having demoralized staff who worked in the environment which I showed you? So if you can just do something that says, well, look, can we help you with improving, like we did, the staff room, then, you know, they feel better about work. And we know that part of that resilience is about having good working conditions. It's about feeling, gosh, that's really hard out there. I'm going to go to the restroom and I'm going to sit and have a cup of coffee a moment. You know, so I think you have to recognize how it is for people, and then you have to make small steps. I don't know, if Rhiannon, if you want to add to that at all.
I think the only thing I would add is, you know, in the same way that our own workforce wants the right environment to be feel valued and all of the rest of it. So I think, although they are very different contexts, it's almost those sort of Maslow's hierarchy of need, isn't it? You've got to put the basics in there to support so that people can flourish.
I think you have. I think you have to recognize, as you say, you know, you're using Maslow's hierarchy of need. You know, if you haven't got running water on a ward, how can you possibly have good infection control procedures, for example? So, you know, you can take nurses and you can train them, or doctors, and you can train them as to best practice, and you can say this is what you should do. And then if you're faced with an environment that you haven't got running water in, how does that make you feel as an individual? So, you know, dealing with those things, I think, are really important to help nurses and other health professionals feel valued.
Thank you. And that's exactly what's been raised in the chat. Angela's says it may seem very basic, but wondering whether attendees at some of your workshops and online or face to face, whether being fed might increase the engagement, maybe on both sides.
Okay. Sorry. Can you give me that question again?
Angela Gorman has asked that attendees at workshops, whether they're online or face to face, would it help if attendees were fed? Basically, if you provide food, that's it.
I think that's a really interesting question, actually, Angela, because we didn't provide food for the workshops that we held in Namibia. And I was absolutely appalled that we hadn't done that, because, you know, I knew there was money in the budget, and I thought, gosh, why haven't you organised lunch for these people? So yeah, I would agree that the provision of food is really important. And in Malawi, there was food always provided. So, you know, we use some of our budget for that. Yeah, so important point, yeah.
And I like Kerry's made the point that combining QI methodology and leadership is you can't do one without the other. So she's working in Kenya and using similar principles. So that's really interesting. But we are kind of winding up now. So unless there's another burning question that anybody quickly puts in the chat, there's a lot I'm going to go back and watch this again because there's a lot that I want to go over. Just one thing I wanted to mention was about engagement at this end, because we do have the Welsh Health Circular, which is from 2006, but it's still in force, where NHS staff are able to ask for up to a week's leave for volunteering in Wales and Africa, and that can be used for doing things here. It doesn't need to be to travel. So that may be something that your staff here could use, because we need to embed some of this in the day job, don't we? We need to give people protected time to do it, because it does pay off in the long run. You know, it's an investment in professional development here. So just to highlight that, and for anybody who's interested in that, I can send links. Just ask me, email me, and I'll send a link to the Welsh Health Circular. So thank you again, Rhiannon and Diane. Absolutely fascinating to hear about this, and let's hope you go from strength to strength through the Nursing Now steering group and the direct work that you're doing. I think, Beth, do you want to put up a couple of the polls? We really like to have feedback from people. So while people have a look at the polls, you can see that on the right hand side if you click on the little button saying polls. So that's always helpful to us. So just to highlight to people, our next session at 1 o'clock is Dr. Chulwe Jacobs, who is, again, she is a nurse leader working at the university in Zambia, who is going to talk about maternal health in Zambia, the challenges and progress through COVID, because one of the big things in sub-Saharan Africa has been the impact on essential services that are not directly COVID related. So the impact on maternal health and child health in particular has been a huge concern for WHO. So it'd be really interesting to hear from the Zambian experience how that's working out. And then we've got the next session at 2:30 from Swansea Medical School, talking about their response to complaints about racism from their students, and we'll combine that with the anti-racist charter that Hub Cymru Africa is drafting and consulting on at the moment. And then the biggest session of the day is at 4 o'clock, where we've got 4 of our links presenting on what they've done in response to COVID over the last 12 months. So that'll be absolutely fascinating. I can see Angela's here, so Angela will be speaking later in that session. So and spread the word, tell all your friends to come and join us later. So over to you, Beth, if you want to have a look at the polls. Are you happy with?
Yeah, that's fantastic. I'll leave them open for a few more seconds, but yeah, just to say thank you to our fantastic speakers today and Catherine for chairing the session, and hopefully we will see some of the attendees in the other sessions this afternoon.
Thank you.
Thank you very much, everybody.
Thank you.
Bye. Bye.